Assalamu alaikum everyone. Today I will be presenting a very interesting and unique clinical case titled Treatment of Recurrent Pyometra by Surgical Uterine Drainage in a Maine Coon Cat. This case is special because it involved an attempt not just to treat pyometra but to preserve fertility in a valuable breeding queen. Before discussing the case, let's briefly understand what pyometra is. Pyometra is a life-threatening uterine infection that typically develops during the luteal phase or diastrus. It is usually caused by opportunistic bacteria, most commonly E. coli. In cats, the clinical signs may be mild and non-specific, such as vomiting, lethargy, or anorexia. Unlike dog, increased urination and drinking are rare. Vaginal discharge may be present, but due to grooming, owner doesn't often notice it. The gold standard treatment for pyometra is ovariohysterectomy, which is curative. However, in valuable breeding animal like the cat in this case, owner often want to preserve fertility. Therefore, alternative treatments may be explored. The patient was a 3-year-old intact female Maine Coon cat with high reproductive value. She was referred for a Theriogenological exam for an ultrasound showed an enlarged uterus. She had 2 previous episodes of pyometra, both treated medically using aglipriston, cloprostenol and antibiotic. Interestingly, she never showed strong systematic sign, only mild inappetence, so medical treatment was initially chosen. On physical examination, the cat appeared in a good general condition. Only a slight vulvular discharge was noticed. Diagnostic tests showed no significant change in hematology or biochemistry. Vaginal cytology showed more than 80% keratinized cell, which indicate estrus. Serum progesterone was below 1 ng per ml, confirming she was not in diastrus. The cat also showed typical estrus behavior. Ultrasound at referral confirmed a marked uterine enlargement with a maximum diameter of 26 mm. The uterus was filled with a non-homogeneous corpuscular material and mild periuterine effusion. Based on these findings and her history, the suspicion of recurrent pyometra was very strong. The goal at this stage was to induce the diastrus phase and attempt a full medical treatment. Ovulation was induced using HCG and progesterone levels confirmed the luteal phase. Aglipriston was administered on day 1, 2 and 8. Cloprostenol was given from day 3 to day 6 and marbofloxacin was continued for 7 days. By day 8, ultrasound showed a normal uterus which suggested successful treatment. However, the cat returned to heat and mated again. Unfortunately, 21 days later, ultrasound showed another recurrence of pyometra without pregnancy. At this point, the medical protocol had failed twice, even though it was correctly applied. The owner was very clear that they wanted fertility preserved at all cost. So another approach was selected, that is surgical uterine drainage combined with medical therapy. The idea was to physically remove all the infected material and lavage the uterus while avoiding complete removal of reproductive organs. A laparotomy was performed. The uterus was exteriorized and a small 2 mm incision was made at the apex of each horn. A sterile urinary catheter was inserted to drain the contents. About 150 ml of thick milky fluid was aspirated. After drainage, sterile lukewarm saline was used to flush the uterus. Routine closure of the uterine incisions and abdominal wall was done. Post-operatively, aglipriston was again administered on day 1 and 2 and marbofloxacin was continued for 7 days. Cytology of the uterine fluid showed numerous segmented neutrophil confirming pyometra. Bacterial culture surprisingly showed no growth, which was likely due to prior antibiotic therapy or bactericidal effect of activated neutrophil. On the 3rd day, post-operation ultrasound showed a normal uterus with no fluid accumulation. The recovery was smooth and the cat was discharged after 7 days. Over the 6 months, regular ultrasound monitoring showed no recurrence. Most importantly, the cat mated naturally and achieved a normal, uneventful pregnancy. This case demonstrates that surgical uterine drainage combined with the medical therapy can be a successful alternative in a selected breeding animal where fertility needs to be preserved. Thank you so much for listening.